our remit is to look at the development of key breaststroke skills for age group swimmers 9 to 14 years of age. What I'd like to say is, as a coach and a physiotherapist, I think it's essential, the link that we have between land and pool. And I think that on a senior level, most coaches know that land is important for things like power and strength development. But maybe within our club programs, we're not spending enough time with our younger swimmers developing land for all the other reasons it's important. And John's just touched on stability whilst he's been with Ewan this morning. But I would say that there are lots of aspects of land that are important for helping us to obtain good skills in the water. What land gives us is it gives us a better body awareness and proprioception. So that very often, swimmers don't know quite where they are. And so if you can get them to learn that on land, it's easier to obtain things in the pool. So proprioception, instilling good movement patterns, correct movement patterns, helping to work, mobilize restrictions in range of movement. Very often we are trying to correct things in the water that actually can't be corrected in the water. And so you're hitting your head against a brick wall saying, get streamlined, get streamlined, get streamlined, when actually physically they can't obtain that streamlined position. So we should be working on the land first. And finally, that also helps with preventing injuries. So it's really important. And I hope by the end of today, with the amount of input that you see from John, that you'll go away and realize just how important it is to be doing a little bit more, and it doesn't need to be a lot, but a little bit more on the land, and maybe not as many meters. What we're going to do first of all is we are going to cover some drills, and I'd say that you may not, some of you may not learn anything new with regards to the drills that we're doing, in that you're probably using some of these drills within your program already. But I think the important message to get across is that you need to do the drills well. It's really important that we do the basics well so that swimmers can learn the correct movement patterns, and then we can move on to maybe the fancy stuff that everybody likes doing, because there are lots and lots of drills out there. And we tend, because we're a bit competitive, both as coaches and swimmers, to often want to do the hardest things first. But unfortunately, if you don't get those basic movement patterns and you go on to the more elaborate drills, all that happens is that those movement patterns break down and you start practicing incorrect movement patterns. So I think the key for us to get across today is that it's not about being fancy, it's about getting the basics right, getting those basic movement patterns correct, reinforcing those, and then gradually progressing more difficult drills or into full stroke. And that needs to be the key message today. So I'm going to return to the float position that David loves so much. Pop yourself in the water for me, David. Ewan and John were talking a little bit more about stability, and we're now going to have a little bit more about restrictions that might restrict your range of movement and affect your glide position. And what I'd like, as far as breaststroke's concerned, it is the most inefficient stroke that we have. And so being able to obtain a good glide position, a good body align is absolutely essential for reducing front resistance, not only on the starts and turns, but on every single stroke. So if we do have restrictions, we need to sort of try and address those. So I'm going to get, David, if you can float on the water, and just a normal float position first of all, and then what I'd like you to do is sort of look at pressing down. If we had a restriction in our lap, demonstrate that back position for me. Lie out for me. So here we have the float position we've been using. Do you want a float? Do you want to? So when you're looking at float position, it's a good way of being able to assess whether or not swimmers that you're coaching can actually get into a good alignment position. Now on breaststroke, I like, instead of one hand on top of the other, David, go into your breaststroke position. I like to see the thumbs interlocked and the hands together. So in that position, that actually unloads David's shoulders a little bit and also makes him more symmetrical. In that position now, if you had a restriction in your range of movement, in your thoracic spine, your lats, your pecs, it may affect the upper body position. So David, if you can do that again with a slightly rounded back and the arms pressed down. Ready? So you might see something like this, where the hands are pressing a little bit down and we get an increase in the thoracic spine position. Guys, do you want to get in and show me your float position? Relax. You can use your snorkels if you want, and if you can have it into the water, and we'll see whether or not any of you have those restrictions that we're looking at. In you get for me. So, floats. That's it. Just the same position that you did with Ewan. In you jump, pull boys in, front floats. So you can lie on your tummies now in that float position with your thumbs linked this time. Looking down at the bottom of the pool. Off you go. So what you look for is, and I think we have a nice demonstration over there in lane 8, of that thoracic curve, which is corrected slightly, and a lumbar lordosis, where she's a little bit more restricted. She's got a curve in her lower back. So she's in an tilted at her pelvis and her thoracic spine. She's corrected it slightly now. Good, well done. Now the other thing that we would be looking at in that position is where the hips lie. And this is not only for breaststroke, but also for fly. So we're looking to see whether or not the body is rotated or whether it remains in a horizontal plane. If you've got a rotation in the body, it may be that as coaches you pick that up as a shoulder, either a shoulder high or low, or that one leg is higher or lower than the other. And sometimes I hear people trying to correct that position from the shoulders or legs, but very often, and in fact in the majority of cases, anything to do with the shoulder and the foot, the leg position, is to do with the pelvic alignment. And that can be due to either tightness in the hip flexors on one side, that means that we have a tilt on the pelvis at one side that causes the pelvis to rotate, or it can be to do with tight erector spinae. So if we float again, and let's just have a little look at that pelvis alignment. Lie down, off we go. And we're looking for a level pelvis. Off you go, faces down. So you can see whether or not. Now with the pull buoys, it'll help slightly. And we've got some pretty good alignments there. But you can see again in lane 8, that thoracic, that upper back out of the water. And relax for me. So what I'd like now is John's going to spend a bit of time, and instead of, time out, instead of looking at stability, we're going to look at restrictions, things that prevent you from getting into that glide position. Just coming on from that, just trying to tie in that why that glide position is so important. Everybody back in the pool. What we're just going to do is sink, push, glide, and hold. And see then if you can actually watch as well whether they can hold that position under the water, because then we're going to take that into full stroke. So when you get Summers, and you get David. So on the push and glide, I always like to say sink, because some of them push over the top and down. It's important. Remember, we're dealing with Summers that are 9 to 14 years of age. So you do need to sink to be able to get nice and deep. And the idea with the push and glide is that we're looking down to the bottom of the pool and we're parallel to the water. In you get. David first. Push, glide, and hold that glide position with the hands together rather than one on top of the other. Off you go, David. Glide and hold. And you can still look and assess hip position, streamline position, and that's David's distance. In you get. You guys, see if you can beat him. And ready, off you go. Sink. So just some of them just need to be a little bit deeper, they're a bit shallow. It's important to reduce that resistance by getting slightly deeper. Come on through, back over here. Then all I'm going to ask David to do now is to swim full stroke. And thinking about that body line that we've just talked about with Ewan and John, is we're now going to think about that glide position, that body line in the glide phase on breaststroke. So I'm going to get David just to swim 50 meters, and you lot can count his strokes for him, okay? All right, David. Off you go. So, body line, a little bit shallow there. So every single stroke, trying to make sure that you get into that position. How many? 4. So having worked on something with regards to the body position in the glide, that's what we need to then make sure that we are reducing the front resistance on breaststroke by getting into that position. Would you all like to have a go? 50 meters, count your own strokes, but just try and make sure that on every single stroke, you get into that really good body line. Ready? Off you go. Right, we're going to move on to legs, David, so if you want to get out. Yeah. We're going to go on to legs now with hip restrictions, if you want to do those straight away. So you can go down to... So I think that,
do you want to dry yourself off
as
now,
we were mentioning about breaststroke being the most inefficient stroke,
so mate,
one of the
we're going to do
main ways you can make a very quick difference with age group swimming is just by working on that alignment position and reinforcing the importance of getting that glide position. The common faults that you will see there, or see in many of the swimmers, is during the glide phase, some of them don't have the hands together, and you need to encourage that hand together action. Making sure that the head is between those arms, but most of the restrictions are related to that streamlined position that we've just covered. Out you get. I don't know how many times, one of my pet hates, and I know we've all seen it, unfortunately with teachers that are teaching breaststroke leg kick, how many times have we seen this on pool deck? Heels together, hip flexion, kick out, and in a circle. And the problem is, with our young kids, is then we have the headache of trying to re-educate incorrect movement patterns. And I think that this, what I'm going to show now, is really good for the teachers to be using, and so within your club programs, you might be able to influence teachers on breaststroke legs. So, lying down flat. And we use this within the club, David does this, but I'm going to use the real basic one to begin with. So you can take your heels up to your bottom. So having the knees slightly apart. In this position, making sure, just activate your abdominals slightly so that you tuck your bottom under slightly. So obviously we're limiting hip flexion, so it actually helps to mobilize the hip flexors at the same time. We need the heels apart, but in line with the knees. And in breaststroke kick, we obviously want to think of a cylinder that we're trying to kick within our body width. In this position, all I do is get the little kids down there straight away and just ask them to point their toes, point your toes, breaststroke feet. Point your toes, breaststroke feet. And I give that as homework. And it's amazing how many people can't do that. That's proprioceptive awareness. David can't see what his feet are doing. With your young kids, you'll be amazed how they can do one foot and not the other. But that's a really good starting point. with youngsters that are in the teaching group to be able to take that home as homework to do as a first. Once we move on from that, you can actually move into, so you can progress this so that you can work with one leg pattern. It's great for the youngsters in awareness. Take one leg up. Trying again to think about good body alignment. And then you can work, bend your heel up towards your bottom. So looking at this position, again, looking at position of the heel. The heels should move out slightly on the recovery phase. The heels shouldn't be together. The heel needs to be in line with the knee. And what we talk about is the inside of the heel of the sole of the foot and the shin as being the blade that's going to push back on the water. So from there, you can get swimmers to kick straight back, backwards, kick, and then we won't, go again, bend it again. Rehearse, foot position, knee position, drive backwards. So it's a good position to start with, to be able to practice those awareness drills for teaching youngsters how to get the feel of that. I never, ever talk about out on breaststroke. Never talk about kicking outwards, always talk about driving back and together. So this is a good position to start with. Once they can do that, transfer them into the pool. David, if you can go to the side of the pool. All of you can join in, but coaches, if you can take them through what I'm going to do. David, come over. So again, you towels off and join in, guys. Copy what David's doing. So really nice way of getting that awareness position, just to bob into the water and use the side of the pool. Here you go. Resting on your forearms. And I do this with David. David's group will tell you that, you know, European Junior, and he does this position as a breaststroke practice. Pelvis against the wall. And the first thing he's going to do is put himself in that position that we did in lying on his front. So bend both legs up. Heels come out, knee and heel in alignment. And then in that position, you could get, if you've got kids that are having difficulty getting the foot position, you can do your pointy toes, breaststroke feet. Off you go, pointy toes, breaststroke feet, pointy toes, breaststroke feet. So it's great for teaching them where their feet is, and also for you to be able to say, your right foot's not doing what you need to do. And from there, you can then work on driving down and together. So using that inside of the shin and the inside of the foot, drive straight downwards. Off you go. And together. And again, just keep doing that. So as he recovers, the heels are out in line with the knee, and then he's driving straight down and together. There is no out movement. When you're doing this, you can emphasize different things to do with the breaststroke leg kick. So as we're doing that, it might be that you want to concentrate on the recovery phase of the legs, where we're looking at a slight dropping out of the knees, the heels coming out to be in line with the knees, but we want that action to be fast. So I change the emphasis, and I would say to David right now, do that, but make sure that the recovery phase, heel to butt, is fast. Off we go. Yeah, so you can just actually do that as a drill. Start from the bottom position and fast. But it's a good position, one, for swimmers to become aware of what they're doing with regards to that. I think it's important. You lot all have a little go at that, and I'm going to talk at the same time. So have a little go by the wall. Can I just say, really important, David, on the front, on the top again, lying on your tummy, whilst you guys have a go at that drill, climb out. I'm going to just talk about the importance of lying on your tummy. When you're doing a breaststroke kick phase, there is a degree of medial rotation of the hip that naturally occurs. I don't think you need to teach it. I think it occurs naturally. Take your heels up for me. So guys, you try and do that leaning on your forearms. If you can get them to lean on their forearms just like this. That's it. Good. Hips against the wall, can you see? Hips against the wall. Now obviously when you're doing that kick against the wall, you're limiting hip flexion. When we do breaststroke full stroke, we obviously do have a degree of hip flexion occurring. But this is just, one, good for mobilizing, but two, to get that pattern of movement of the swimmers thinking about heels towards the bottom rather than knees towards the chest. So it's quite nice for that in those early stages. The other thing that we need to think about and why it's important is the common faults that you will tend to get will be those swimmers whose knees are too close together and whose feet are way outside the width of their knees. So they're going into that medial rotation position. And where you have swimmers that are doing that, if they have a range of movement, you see it with some of the girls that have not got so much hip control, when they actually kick backwards, that'll force them into more medial rotation of the hip. And it's faults like that that actually can go on to create pathology in the hip joint itself. So groin problems can be associated with that incorrect action. The other thing to remember when you do that, and I've seen people teach breaststroke with a pull buoy between the leg, is that they have to end up going outwards rather than driving directly backwards. In addition to that, where the knees are very close, if you're kicking back in that position, it puts a great strain on the knee joint itself, forcing the knee into what we call a valgus strain, circumducting at the knee joint and putting that strain on the other area where we get breaststroke problems, which is the knee, very much in that medial section of the knee. So having that correct position where on the recovery phase the knees do move out slightly is really important, not only for propulsion so that we're kicking directly backwards, but also for protecting swimmers from the groin and knee problems, which tend to occur as a result of the incorrect position of the hip. Now, if you don't have enough medial rotation in your hip, what you may see is that the knees go very much outwards because they don't have that medial range, and then we get the kick out. So it's important to make sure that you have got the range of movement to be able to get yourself in that optimal position. Okay, well done, guys. Out you come. So from there, that's a really good position to do stuff. From there, I'm going to take David into the pool. And guys, if you get back in your lanes. And you get into the middle lane for me. We're just going to go in that nice glide position, so still holding our body line. We're going to look at kicking under the water. So we need a good depth. And David's going to kick the full length underwater. You guys can try, but happy for you to come up at 15 meters or wherever. With youngsters, use the width of the pool. Get them to kick on their front for the width of the pool. That's a really good base. We don't use the widths enough. So in the water for me. The great thing about the underwater kick is if you're deep enough, it's good also for David now to transfer that feeling of a backwards kick, driving back and together, so forwards movement, whilst maintaining that good body alignment. So his eyes should be looking down on the line. Hold the glide position with the upper body, and then he's going to work on that kick phase that we've just been talking about. Off we go, David. You guys want to get in and copy him in a minute. Ready? Off you go. So streamline position. I prefer this. It's a little bit shallow. I'd like it slightly deeper. Guys, if you can go a little bit deeper, down you go. Full length, underwater. You want to have a go? So we use this quite a bit, and off you go, swimmers, as far as you can go. And it's great for obviously developing lung capacity, but breath holding work, but also for getting that feeling of that drive. And you as coaches, it makes it easy to see whether there are any faults that you need to address. The other thing that's good about this is you can use it as like you do a stroke efficiency index, where you do your stroke count and time, and you add those together to give you a stroke efficiency index on full stroke. Well, you can use this as a kick efficiency index. So as they move on, you can add a time element and a kick count element as a way of monitoring improvement, but also a way of them increasing the speed of the kick as well as the distance that they're traveling. So, guys, I want you to do it again. David, how many kicks did you do on that last one? 9 kicks. So we're going to do one more 25 underwater. Can you lift the speed of that now, but slightly deeper under the water? Guys, if you want to go for the 15 meters again, ready, off you go. So again, all the time looking at the alignment. You can change the emphasis of the underwater by asking them to work on the recovery speed of the legs, or to work on the drive phase of the legs, whatever section you want them to concentrate on. And from there, into full stroke breaststroke, and we're going to, now David's just going to do 50 meters breaststroke, where he's thinking glide, but also drive, nice strong drive backwards on the water, so that we're getting that forward movement. Obviously, the faults there, if you're kicking outwards, is we don't get so much forward propulsion. So are we ready? We're going to do 50 meters full stroke breaststroke, and you're going to think about glide and that really strong leg drive. Ready? Off you go. So you need to look, when you're looking at the swimmers, think of that imaginary cylinder, and think about that leg kick needs to be sort of within the shoulder width of their body, maybe slightly wider for some swimmers, but not excessively outside of that. Anything that is too wide is going to increase the resistance and make them slower. So the glide and the kick. One of the practices that I find quite nice, again, for proprioception work and being able to influence what your swimmers are doing, is to actually use the side of the pool. So David's going to lie across the pool with his torso in the water and look at that out skull. So obviously he needs to breathe occasionally. You could use this with a snorkel. But I actually quite like it because it means you can also look at the timing of when you're going to breathe. So in this position, what I want to start with is the position of the hands at the end of the recovery phase, where the hands are together. David, into that position. From there, rotation of the shoulders so that the hands are pitched at a slight 45-degree angle, and then he's going to press outwards. And just hold that position and breathe and relax. So this is the sort of place that you can influence. So we can transfer those exercises that John's just done into a Y position to start with. So go into the Y position for me, David. Face down, you've got body line, set is scapula, hands at 45, right hand's just a little bit nearer 90 at the moment. Take it to 45, David, so that that palm is slightly more down towards the floor. You can influence in this position where their hand positions are, and work on scapular work there. So bring it back together, David. So we're now looking at the hands start together, the shoulders rotate, so the pitch of the hand is at 45 degrees, and then David's going to press out and slightly down with his hands into that Y position and return. So I'm going to ask him to do 5 of those without breathing, with that scapular control at the same time. Off you go. You guys want to have a go? So nice positioning for you to be able to transfer that scapular work into the out skull, but also for you to be able to give feedback. Very common errors on breaststroke out skull, and you'll see this quite often, is the swimmers start with a flat hand, and they never pitch the hand. They don't get that shoulder rotation, so they've got flat hands. They're not getting purchase of the water. Take a breath and just keep repeating it, David. And the other things that you see are those people that don't fully extend the elbows. So they should be leading with their palms and their hands rather than leading with the elbows. And you'll see those swimmers that bend the elbows first and lead with the elbows into that out skull position. The other thing that you can do in this position is make sure that when the swimmers breathe, they only breathe at the end of the out skull, so that you can actually sort of influence a little bit the timing of when they breathe. I mean, the breath itself will take place at the end of the out and into the in skull, but what we don't want is those early breaths at the beginning, either when the hands are in the front recovery position or as they're starting that out skull position. So that's one of the first things that we use. You can actually progress this, just a moment, and I use a cord, and they do partner work on this. So David, take the cord for me. So we go partner work, where cross the cord over, and I feel like, you know, I'm now a chariot on my chariot. So exactly the same thing, face down, set the shoulders, and pitch the hands and out skull, and come back. Pitch, and this is all to do with patterning, helping with the patterning of movements, increasing proprioceptive awareness, and relax, so that we can transfer that into a drill. So from there, guys, up we come. David, can we pop your fins on and go over into lane 1? And we just move on to breaststroke out-sculling drill. And what I find is that if you want to help with motor skills, don't be afraid to get them in and out of the pool in a session. And we'll do things like activation, then we'll go on the side, and they'll try, 10 reps of that skill on the side, and then we'll go in the pool and we'll do out skull. Because that way you're learning a pattern of movement, and you're transferring from land what you require in the water, and you're helping swimmers to understand what it is you're asking them to do. And I think that's really important. It's very hard to teach something if you haven't got that good basic awareness. So David, if you can go into out skull now, and I'd like you to breathe every third out skull for me. And try and breathe at the end of your out skull phase. Off we go. Yeah, one length. So if you guys want to put your fins on, you can join in with this. Okay. Off we go. So transfer that same feel, head position, pitch of hands, into nice, gentle. And it's really important. One of the things, what we've got to remember is David is only 17. He's changing all the time now, and I have to adapt things for him because of height changes. There are obviously coordination issues and restrictions that we gain, that he has as a result of growing over the summer. And our head position changes that we need to look at, and we're constantly having to reevaluate the things that he does. And he tends at times to rush that front phase, and it's really important that you reinforce that you don't want to be rushing that out skull. So from there, guys, if you'd like to do the same thing, we're going to go on to the next drill. You can try that first one now, out skull only, is that we're going to move on to 3 out sculls, 1 breaststroke arm stroke. You do your out skull, off you go, and off you go. So David's going to come back on 3 out sculls, 1 breaststroke arm stroke. Coaches, if you can let them know that in a moment. And what we're trying to do here is only breathe on the breaststroke arm stroke. So we're trying to transfer that out skull into the breaststroke arm stroke drill. And the timing is really important here as far as when you're taking the breath. So David is going to be trying to make sure that he gets the timing of his breath so that that's during the in-skull phase. Off we go, David. 3, 1. So just taking what we've done on land, on the side of the land, into a full arm action. When we do the full arm action, nice strong leg kick into the glide phase, and make sure you get back to that glide phase. So touching the hands together, pitching the hands, pressing out and down, 3 out sculls, 1 breaststroke arm stroke. The swimmers like to have a go at that. Off we go. And then from there, we move on to just straight into breaststroke arms, freestyle legs. And every single stroke that David does, I want him to make sure he gets into the glide position, that he pitches those hands and feels that out skull. Strong leg kick into the glide phase. 50 meters, breaststroke arms, freestyle legs. So you can see that the common faults, off you go, that we see with some of the younger swimmers here is that their out sculls are a little bit narrow, and so that needs to be just worked on a little bit. Obviously, you know, the width that people go as far as the out skull is dependent on the power they're able to generate. And some of these are a little bit young, and so a really wide out skull might not be beneficial, or they may not be able to control at this point. Again, the other faults are that flat hand position that we've already talked about, and at an early breathing position. So we can go into freestyle with freestyle legs, and then take your fins off, and then just transfer it straight into full stroke. And that's the type of pattern I would use in training. I would go land, chords or feel, drill, build the drilled up into full stroke. And we just keep rotating that type of thing around. Full stroke, take advantage of the glide and the feel in the out skull. Ready? Off you go. You guys can have a little go at breaststroke arms with freestyle legs, making sure you get that nice glide position and making sure that you pitch those hands and feel that out skull. Okay? Off you go. So when you do your drills, always, you can change the emphasis, but here the emphasis is on out skull. And just break it down, give them a chance to reproduce. Good body line, to feel the out skull, work on them as separate components, and then put them together in full stroke. Now we're going to move on to the in skull, so David needs to come out and work with John again now. Out you get, David. Now, I obviously would have spent a lot more time on the side drill with these guys to be able to get that perfect and get them working in two. The in-skull drills. David, if you can move across to the side again. Summers, if you want to come around to the side again as well.
You right, man.
So we're going to look at in-skull, and first of all, I'm just going to look at a quarter in-skull. And David's going to go in the same position across the pool, and he's going to go into that Y-skull position. And all we're going to look at from the Y-skull position is just a downwards and an inwards movement of the hands with the elbows staying fixed to begin with. Small movement. In you get. Across you go. And again, I like this position because they work in twos. You can influence what they're doing. He can hear what I'm doing. Y-skull position. So you start from where we've left off, and then we're just getting the hands to move down and in. Just a small movement, just that little catch movement, the hand moving inwards, and the elbows staying fixed. And from there, we just take that straight into a drill in the pool. I sometimes use chords in this position as well to do that same bit, but we're going to move on into fins, please, David. If you want these guys to just practice that whilst David's just have a little go at that here on the side. And David, if you can go onto your fins. So just make sure that that head is just slightly lower in the water. Just 25, yeah. So David's just going to go 25 on this drill. And again, just the same as before, when we work the in-skull stuff, we always go land first, over the side of the pool, with or without chords, and then into a drill practice. And I'd like David to breathe maybe every third or fourth in-skull, and just to do it nice and slowly. Off you go. The faults that you find on this, with this drill itself, is that It's the start position that's so important. And that's where the education in the lying over the pool is so important. Because if the arms are too narrow, you can't get that inward movement. If you're too narrow with the shoulders, what you end up getting is the elbows being pulled back. You can't get that changing pitch and that in skull at the beginning. If you're narrow, you end up with a press down or the elbows being pulled in. And from there, just take it into full breaststroke arms, freestyle legs, David, but just making sure that you get that out skull position and that emphasis is on that small part of the in skull. Off we go. So very commonly, the faults are the hands are too flat to begin with, so we don't get that nice subtle movement, and the elbows are drawn directly backwards, or we get that polishing type of stroke, where we just keep the water surface nice and clean, but we don't do anything effective. From here, up we come. We're going to move across to the side position, and you guys can have a go at this again. Out you come, David. And we're going to move on to sort of the full in-skull action. Could I borrow your Swiss ball for this?
My recovery phase, but don't worry about it.
All right, shall I leave it?
Take too long.
Well, I'd like to know it. Okay. So I just get David across the Swiss ball so that you can see him. Lie forwards over the Swiss ball. Okay, so it's nice and stable. And then we're just going to get him to go into the Y position. We're going to get that. And again, you can correct on land things that you can't correct in the pool. From there, that little subtle movement of a downwards and an inwards movement with the hands. And then from there, we're going to sweep inwards. So the elbows will come towards the chest. Okay, David? Yeah. And in. And you can practice it in this position. And then take it into the water for me. Across the pool. Across the... I know, I'm rattling through. I've got Lindsay in my ear telling me I've got to move on. Over we go. And this is where the timing's important as well, because this is also where the breathing takes place. So trying to time that in skull with that breathing action. So into that Y skull position, set the shoulders, and then that subtle movement into a full in skull. Now what I sometimes use is a woggle, and I put the woggle around their chests, and as they do that, I lift them up to help with the back extension. So all sorts of cheaty things that you can do to actually help. So just practicing the pattern of movement. Okay, David? Take that now into the pool for me with fins. You guys want to have a little go at just feeling that. And it's trying to get those elbows in towards your chest. Think, sweep, rather than pull. Always, breaststroke, think about sweeping actions. Try not to mention pull, otherwise you get a pulling backwards movement with the arms instead of a sweeping in motion. So that timing of the breath is important. We don't want to pause at the end of the in-skull, which can sometimes be one of David's faults, particularly when he's swimming slowly, and it's something that we're working on. So we now transfer into the full in-skull with breaststroke, freestyle leg kick, just to maintain good body alignment. Off we go. I like the fins for that reason, just to help with the body position, to enable them to actually feel that. And this is one of the areas that David in particular needs more work on. His in-skull power. And it's the weakness, one, with a number of things, that he does tend to also pause slightly at the end of it, but it's something that we're working on at home to hopefully have an improvement in this season. And I think that when you watch somebody like Petey, Can we go breaststroke arms, freestyle legs? That's something that you can see he's very effective with. He gets, off we go, he gets lovely lumbar extension, so that his whole body uplifts out of the water. David's much flatter than what Petey would be, but David's also much younger. So transferring the two together. Okay. And then from there, we can look a little bit about the recovery element of the stroke. So David, again, if you can come up out of the pool for me. And we're just going to go on to land and just look at really simple little drill. And if the youngsters want to watch this, they can have a go at this themselves. So lying down on the floor, propped up on your elbows. Okay, so in this position, we can look at setting the shoulders, making sure that deep cervical flexors that we were talking about, getting David's head in line, because he tends to poke his chin slightly forwards because he's got some tightness in his upper cervical neck extensors, and that's something we have to work on, but trying to get that position. And then if you think about the recovery phase, and this is the timing of this, and you see someone like Petey, we've got the body, upper body comes up out the water, the lumbar spine is extended, and then you're using that kinetic energy and gravity to assist a fast recovery of the arms forwards. And what we're looking at is the timing of the hands moving forwards, up and over or on top of the water at speed, with the head and the shoulders following that line, so that if it all works together, we're straight into that glide position. So I like to practice that on land. So we go from here, we call it the strike drill, and then we go strike. Okay, and come back up. The only difficulty with it on land is that David can't get his head quite flat because his nose is in the way. And I haven't really found a solution to that yet, but there's no reason why this drill couldn't be transferred in the same way onto the pool over the water. So from there, set the shoulders, and I actually get him to activate the deep neck flexors, which he's got a way of doing, and then strike. So simple exercise to do, and it can incorporate that scapular work at the same time. The common faults here that you see in the pool are those people that finish the extension phase of the arms and leave their head up. So they don't time the head with the arms. And so then you get that increased frontal resistance. And in addition to that, where you've got those restrictions in lat length, then you see as they go forwards, they can't quite get their heads into the right positions, and the hands are too deep at the end of that recovery phase. So from there, fins on, David. You can just use that drill as a strike drill, and all he's going to do is keep his hands together, and he's going to bring his elbows into the chest and then forward. So I'd like the swimmers to have a go at this. Link your hands together. Your elbows are going to come into your chest, and then you're going to strike your arms forwards. There's no out skull or in skull. But you've got to have a strong leg kick on the strike phase. And when you strike, I want you in that glide, in that really good body alignment position. Okay, are we ready, David? Remember to lift from the back so that we're lifting the body up out the water. Ready? Off we go. So I say set, strike, set, strike. With freestyle legs, set, strike. Do you want to have a go, guys? And this way, this is one of the drills that I'm helping with David at the moment, because he tends not to use that lumbar extension enough to try and lift the body. Guys, do you want to have a go? So you're going to keep your hands together. You're not allowed to part your hands. Imagine keep the thumbs locked, and all we're going to do is slide the elbows towards our chest, and then we're going to shoot the arms forwards and get our head down as quickly as we can. And when we shoot forwards, we're going to strong kick. Okay? In you get. David, you'd like to do the same thing coming back? Ready? Off you go. And it's getting the faults again and looking at whether or not they can get into that glide position. Much harder to do without fins, especially when you're only using one fin. But again, details. Be meticulous about the details. Every drill that we've done, we're still getting back into that glide position because that is so important in breaststroke. And from there, guys, take it into breaststroke arms with freestyle legs and think about fast arms forwards into that glide position, and I want you to hold the glide. So David's going to start. So breaststroke arms with freestyle legs, fast arm recovery, hold the glide position with strong legs. Ready, off you, 50 meters. Ready, off you go. And the good thing is also helps with the timing of the breath. Oh, he's gone on to full stroke breaststroke. That's what I did ask him though, didn't I? Sorry, I did ask him that. So the good thing here again, guys, if you want to join him on the way back, is that by doing it this way, you can also look at the timing of the breath here, making sure that you're getting the breath in the in-skull, and then the timing of the head and the shoulders into that glide phase. And an easy way to see whether or not we're getting lots of resistance is to look at the degree of splash above the water. And if the head is left up, we'll get this big spike of splash at the front end of the stroke, and we're trying to reduce that. Take your fins off. Well done, guys. And so just taking it into full stroke, I'm just going to finish, and David's going to swim 50 meters full stroke breaststroke. And as he does that full stroke, and you guys can do the same, he's going to make sure that he gets that glide. And I would normally break this down. I would do it like 450s, but I'm out of time. So I would normally go 150, working on the glide, 150, working on the outskull, 150, working on the in-skull, 1 thinking about the recovery. We're just going to be thinking of smooth and long, David, fast recovery, ready, off you go. So getting that whole timing of the stroke together. And what I haven't mentioned as we're doing this is when you're doing that recovery phase, that's also where you have that fast recovery of the legs to fit in with the arm stroke. So the legs are recovering quickly, heel to butt, so that as your shoulders enter the water, the propulsive part of the kick is beginning to maintain that speed into that glide phase. And that timing is slightly different with different swimmers, but that's what we're trying to do as well.